Hello guys, hi Netherlands. Hello, thank you for watching a program. Okay, we're gonna talk about hormonal acne. Hello, hi Suzanne Metzel on TikTok, SLMD. So we're on multiple different platforms here. Now we have 4 of them. We're on Instagram, on Dr. Pimple Popper, on SLMD, and we're on TikTok on Dr. Pimple Popper and SLMD Skincare. So hello everybody, hello North Carolina, hello Michigan. Okay, so I'm gonna start with one question that we have already, and then I think that they're gonna go around and I have a lot of wonderful people here helping me out, and they're gonna go around and find some other questions along the way too. And I'll try to see if I see anything. Hello Albuquerque, hello Vienna, Bridgeport, Liverpool. Oh my gosh, okay, I have to stop doing that, otherwise I'm sure. All you guys are from such wonderful places, and it's so nice to see you, and I appreciate all of you. So thank you for being a part of this. Okay, from one of the channels, from all of the channels, we have Lind N. Lang, and she asked, hello Lind N. Lang. I like that name actually, it's kind of catchy, huh? Lind N. Lang. What's the best way to treat hormonal acne? I've tried everything. Well, one of the things I like to make sure people understand is hormonal acne. You can put it back up there. Hormonal acne is is actually really common. I explain to people, for the most part, acne is caused by hormones, actually. Hormones and genetics. And that's why you get acne mainly when you are, most predominantly when you're a teenager, and then it tends to kind of wear off or get better or improve over time. But then you might get, like a lot of women will get acne throughout their life, more so because they have hormones. Can you get it?
Yeah.
Take that. I'm sorry, because it'll help me remember who these people are. I'll get a new one.
Okay.
Thank you. So anyway, let me get back to hormonal acne. So a lot of women will notice breakouts during certain times of their cycle. Like right now I have like a zit here and a zit here. So I'll break out at certain times of the month because there's a little surge of hormones when you ovulate and also before you have your period. And that's when they notice more breakouts. So it's kind of a bummer for many of us women. We can get breakouts throughout our life, and that's mainly why. Treating hormonal acne, if you have acne that tends to break out more so in like this area too, like this area, or on your chin or on your lower face, your jawline, we do know that that has a lot to do with testosterone that we have in our body. Obviously males have testosterone, but so do females. But sometimes we can as women can have a little bit more testosterone in our bodies that causes more breakouts in this sort of, we say, beard-like distribution. And that can be due to hormonal issues like PCOS, which is polycystic ovarian syndrome, where people can have benign cysts on the ovaries, but they tend to secrete a little bit more testosterone, so you get more, it's not gonna work either. We're having problems with this one camera, sorry guys. And testosterone in your system, sorry, I'm not explaining myself well, I just literally flew in here and I'm doing this. But so testosterone is something that is elevated, and you can help to control that with a antibiotic called spironolactone, for example. Spironolactone is a great prescription medication that can be used to help it's like an androgen inhibitor, so it can help to minimize testosterone and help to improve your breakouts. It definitely diminishes oil, and it's something that a lot of adult women use. Men can use spironolactone as well, but they don't necessarily need it because it tends to be, we want to control more of the hormones with women. So anyways, that's a long-winded, sorry Linda and Lang, because that was a terrible answer. But hormonal acne can be controlled. See your board-certified dermatologist. They can certainly help. And there are medications out there that can be geared specifically towards hormonal acne. But even like the products that we have, like SLMD Skincare, which is over-the-counter anti-acne treatments, all of those can treat hormonal acne too. All acne is similar in terms of them responding to the same kinds of products. Okay, so we also have then another question from Awesome Male Tutor 69. Hello, awesome male tutor 69. Thank you for the question. The question is how to deal with really bad acne all over the face. Well, I think that the important thing to know, the very most important thing is to know what type of acne you have, like identify the types of bumps that you have. Do you have just blackheads and whiteheads? Do you have more like inflammatory papules or the pimples that we commonly see and we identify as acne? Or do you have the deeper cystic or nodules that you see? So there's I like to say that to make it simple, there's 3 levels of acne. If you have comedonal or blackheads, you want to really treat, and a lot of them, you want to treat them with certain medications, certain topicals that you can find over the counter or prescription. And then if you have regular pimples, inflammatory pimples, you can treat them with also different topical medications. But if you're talking about like severe acne, like if you're saying you have really bad acne, that you have really deep-seated nodules and cysts, you really want to see a dermatologist at that point, because that gets to the level where you want prescription medications, and that's really important. The important reason is because that has more of a potential to lead to scarring, which it can be permanent. So that's why we really want to be more aggressive with that treatment and start something sooner rather than later. But like I said, the most important thing is for you to be able to identify what type of acne you have. Because you have blackheads and whiteheads or comedones, that can be treated with retinol over the counter, salicylic acid, and if you have more like the inflammatory pimples, you might want to look more for benzoyl peroxide or sulfur, those kinds of products. So that's important for you to know, because then you can really kind of more specifically treat the type of acne you have. Thank you for your question. Okay, the handle O'Halloran, and the question is, does diet, did I not say that right? O'Halloran, okay. Okay, you were judging me with my question. I said that, you're like, all right. Okay, question is, does diet have anything to do with breakouts? You know, what I like to say is sometimes I'll have a patient go, I eat tomatoes, and every time I eat tomatoes, I break out. Then, you know what my answer is? Don't eat tomatoes. Because, I mean, obviously if you feel like that breaks you out or irritates you, you shouldn't really have that product or ingest it. But I don't think that food in general plays as huge a role as a lot of people think. I like to say pizza only causes acne if you spread it all over if you rub it all over your face, really. Because, you know, I think when the oil gets on your face, that's one of the big reasons. But in terms of food, I like to really recommend that people analyze whether there are hormones in their food. I think that dairy products definitely can promote more acne breakouts, and that it has a lot to do with the fact that there are hormones in that food. And also like a lot of meat products like beef and, you know, pork and chicken. I think that there are hormones put into those animals to help them to grow bigger or maybe faster or whatnot, and that those hormones can affect us as well and can affect our acne breakouts. So I say stay away from, I think some of the most common culprits for people are dairy and even chocolate, like dairy and chocolate, and some like kind of foods that have hormones in them. Thank you for the question.